All right, hi, it's Matthew Holt. This is THCB Gang. December the 5th. Hopefully, you're going to enjoy this week's episode. There's a lot to talk about in healthcare this week, and we'll have to obviously have to start with the biggest news. But as Michael Millenson, who's on the call with us from Health Quality Advisors, just reminded this is also the 20th anniversary of another big issue in healthcare, which is to Err is Human, the report on medical quality. With Michael, I've also got Brian Klepper from the Employers Clinic Commission, Robin Farmanfarmaian, the speaker, author, and entrepreneur, and Jeff Goldsmith from Health Futures. So here is our gang this week. Hi, welcome everybody. Glad you could all get with me, and I am looking forward to our conversation. Let's start with the biggest news, which is obviously the assassination, murder, killing of Brian Thompson, the United Healthcare CEO, which just one of those awful you kind of think only in America things. And there's been a lot said, and I think you can basically divide it, especially on social media, into sort of two halves. A lot of people on LinkedIn who knew him or were in the business of healthcare or whatever, are just absolutely stunned and shocked by the fact that it happens. And many of us have obviously have had either sort of captains of industry, leaders of insurers and big hospital groups and drug companies or whatever, met them, been at conferences with them, whatever, and have had a fairly open time, and just shocked to think that something like this could happen. But obviously, in America, with the amount of guns we have, stuff does happen. And perhaps equally astounding has been the just pure vitriol being poured out about him and also his organization, the organization he worked for, and every other health insurance industry. And it's kind of like this is quite a moment. So, Brian, I'm going to start with you. You wrote a piece about the sort of the contrast here, and then obviously want everyone else to weigh in. And I think we have to say, look, to underline the fact that it's a terrible whatever one thinks about United health insurers, people who work at health insurers, people who work anywhere in healthcare. There are, there's obviously a lot of feeling about what happens, but this level of violence should never be an answer, whether it's that or whether it's in people in politics or whatever else. But obviously this may be a moment. So Brian, I'm going to start with you. Just sort of reiterate what you said a bit earlier in a piece that you wrote.
So, Mr. Thompson was the CEO of the largest subsidiary, which was United Healthcare, and he was responsible for bringing in 75% of the parent organization's total revenues, which worked out to about $280 billion. And unfortunately, there's a long history with United, particularly, of doing things that are outright illegal and wrong and so on. And obviously, this is the guy who was over all of that. There are 2,200. What I read today, there are 2,200 subsidiaries of United Health Group, and I had written a piece about 5 or 6 years ago about United's behavioral health organization and how they took premiums from people and then systematically refused to pay claims, and they were caught red-handed. And the judge in the case, which went on, I think for 5 years or something, the judge remarked that they were particularly, I don't remember exactly the word that he used, but it was unrepentant, something along those lines. And I think that the fascinating thing that happened yesterday, and you were the one who called attention to it, was the lack of empathy for the guy who got shot, and the identification with the shooter. And I mean, it appears from what we know at this point that this guy had a real grudge against United and went after the guy, the highest guy he could get to, and he planned it and he pulled it off. But the important thing is for us not to appear to condone the act, but to note the level of distrust and distrust and cynicism that the people on social media, who are Americans of all types, have for the industry, and how that has played out with the news of his murder.
Yeah, and I think the one thing I just well said. I think one thing that I noted is that Thompson was he'd been at United for 20 years, working his way up through the ranks, started as an accountant. This thing has been going on for a very long time. It wasn't like he was the founder. I mean, he wasn't Maguire who sort of started the whole thing and put it together. It wasn't Helmsley who kind of took it through the process and made it the juggernaut it is today. Him and even Andrew Whitty, the British guy they have who runs the United Health Group now, who came in from Glaxo, are not kind of like they're continuing on something that's been going on for a very long time. I did note that everyone's talking about this. There's people talking about plutocrats and billionaires and powerful rich people who don't know what real life is like and all the rest of it. He was the fifth highest paid guy at United. He was not so not that he was poor by any means. He made $10 million a year. But clearly this has been set up in social media as people are saying, that this is an organization that denies care, that stops people getting access to care. It has a very bad name amongst doctors, who obviously have a lot of influence with their patients about spreading this. But I mean, I'm still, I just thought when you go down the comments on TikTok and I've had people send them to me from TikTok and Blue Sky and Twitter and Reddit and whatever else. It's not like this is a 50-50. It's 95-5, if not 98-2% in favor of people saying, well, had it coming, the shooter, all the rest of it. So, all right, Michael.
I want to both. Well, first of all, I want to make sure that something Brian said I think is inaccurate, if I might. We do not know the motive. So when you said this is by someone who had a grudge or whatever, there's no information yet as to the shooter.
That is true, but it's been assumed by them 98%.
But the reason I say that is because this could be the actual shooter, in fact, could be a professional who was recruited by someone with a grudge. And well, the reason I say that is and I don't want to split hairs here, but when you say only in America, well, I was at as you know, I was at a shooting only in America at Highland Park, where a guy, a high school kind of dropout, gets a high-powered rifle and just kills people. And this morning when I watched the news, a crazy got a gun, went into a kindergarten of a Seventh-day Adventist school and critically wounded 2 kids who may die. That's only in America because of our gun thing. On the other hand, hiring a professional with a gun and a silencer and a getaway plan and everything else like that is actually something you see in European movies. So
Russia.
Russia would be flying out of a window, but yeah.
But it's not just. If it was a crazy just shooting at the guy, we'd say, yeah, anybody can get a gun. This is so chilling because, in fact, it was a planned assassination. And I agree completely with what Brian said about United Healthcare. Unfortunately, 2 interesting things. One, if you look at the bio of this guy, and it talks about his blue-collar upbringing, and his father was a grain operator, and I think it was Iowa, if I'm remembering correctly.
Right.
It says something about making assumptions about, as it were, class solidarity, right? because United Healthcare shows no particular solidarity for working class people. And I'm reminded of a line from the musical 1776, where the Tory says to the revolutionaries that they'll win because people would rather have the possibility of being rich than face the probability that they're poor. And so here's somebody who comes from a blue collar background and is, listens to people well and all the rest of the ways he's described. But in fact, United Healthcare for years and years and years and years has earned being detested. They've earned that. The second thing is, in terms of the social media, people don't take to social media in general unless it's someone they know to say, gosh, what a shame. But I started to look up all the movies that said, were popular backlash against HMOs and insurance companies. And do you all remember back in 1997, As Good as It Gets, where the hero said, it's Jack Nicholson said something about that fucking HMO, and audiences in theaters all over America applauded because they didn't have the internet. Another movie is John Q with Denzel Washington, Sicko, the documentary by Moore, right? And these are not minor movies. These are movies that tap into major things. And so, people feel that way, rightly or not. So,
well, but there's something bigger here, guys. And
Jeff, you just muted. Try to unmute. Sorry.
There's something bigger happening here. I did retreats for hospitals and health systems during the pandemic, and their emergency room docs and nurses were being spat on and cursed and threatened physically or asking them to mask. You've got a whole raft of folks that are coming into this new administration that have grudges against the scientific establishment, against public health authorities. We are marinating in bitterness now.
True.
And it's true. We had a managed care backlash during the 1990s. It brought a lot of these companies down and paved the way for United to buy most of them.
Right.
So I've sort of been waiting for managed care backlash number 2. And in a million years, I didn't expect it to come from a health insurance executive being shot in the back by a cowardly assassin who lurked in between cars. So, there's a lot of anger out there, not just about health plans, but about nearly every actor in our health system. So to make a moral out of this shooting really bothers me, because there's like a whole bunch of other storylines where shooting somebody, Anthony Fauci is probably an assassination risk because
he's speaking at IHI, and they have to have security screening.
Correct.
We've
so
never
this is not just about the health insurance system, guys.
Exactly.
No, it's not about. It's not. I agree with you, Jeff. There's not a moral here. There's an observation, and the observation is the temper of the American people related to the health insurance industry.
It's not just the health insurance industry, Brian.
The
whole system.
It is the whole system, but it's pronounced with healthcare because it's such a problem.
Yeah, well,
Robin, I'm trying to get you in here for a minute so I can see you.
Robin's turn.
No worries. So I study this a lot, including what's going on at these large health insurance companies. It turns out the top 6 largest of the health insurers are taking 30% of all revenue in the US healthcare system, which is just absolutely mind-blowing.
That's clearly true. And we've had that mass consolidation for a long time, right?
Well, it gets flushed through them, Robin. They have an 85% medical loss ratio. 85% of that money ends up in the pockets of hospitals and doctors.
So let me ask two questions about this, because it's come up, and Vinny Prasad had a go at Dr. Glycoferman, which I think was, who's been making those funny videos about United and health insurance denials for all this time and the rest of it. But a couple of things that were worth observing. One is that and I can't remember if it's just for ACA business or Medicare Advantage or other else, is what does the 85% medical loss ratio limit apply to? So that's the one question. Why do they have prior auth, and why are they trying to, why are they trying to stop excessive spending, blah, 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 for that sector of the business, given what's going on in the other sector of business, which is the ASO business for employers. So that's the sort of the first question. And the second one is a bigger issue, which why do we have quote unquote managed care and overview and all the rest of it in the first place?
Great question.
This goes to what you've been talking about for a lot, Jeff, right? One is, there is clearly straight out fraud and abuse in the system, and, somebody has to pick it up somewhere. And then there's also the fact that we've been, fee-for-service medicine went up in the 70s and 80s, and there was a big, very, very fast growth. And we said, we have to do something about it. And the way we decided to do something about it was to try to police it, both on the Medicare, so the government and Medicare and Medicaid side, and using private actors increasingly for Medicare and Medicaid, but especially for employer-based healthcare, to police it, by utilization management, prior auth, all that kind of good stuff. So can somebody ask me the technical question? Because I just can't remember offhand. Does the 85% apply to everything across the board? In which case, why would they bother? Or is it just for ACA plans and Medicare?
Well, that's why a lot of them are looking at Medicare Advantage as big growth areas, because I think that only applies to the health insurance side, but not, say, the 100,000 doctors they now employ.
Well, so that's another thing.
It's in the ACA. It's in the ACA.
But then it was 85 and 80.
Sorry?
It was 85% for some, I believe it was individual health insurance plans, and 80 for corporate or something like that. I can't remember what it.
But I mean, Robin is dead right. The reason the big insurers have been getting into, and there was a ProPublica piece about this just the other week, getting into what I call provider fracking, buying provider groups and, shaking the spare out of there and doing these intercompany transfers that's in the United piece. It is because they can get away with it. And the ProPublica piece was literally saying that the Optum groups were charging both United, but also every other health plan they work with. As Jeff has pointed out, they work with multiple other health plans, much more than comparable groups. And there's huge variance, as we know, in how much health insurers pay different providers in the same market. I've talked about that enough. So,
well, the irony is, and I think I might have said this earlier without being, entirely articulate about it. The first managed care backlash gave us United Health Group.
Right. I mean,
gave us United Health Group. They bought up all of the struggling HMOs that couldn't make it after the Balanced Budget Act, and then bought up their provider networks with the cash from the insurance. So the first managed care backlash brought us the second managed care backlash. Only now it's 6 companies instead of 200.
So Matthew, real quickly, we've passed Medicare, okay? And we passed Medicare only because we tell the AMA, instead of opposing, it says doctors can charge whatever is usual, customary, and reasonable. Which turns out to be whatever the group of doctors charge, right? So Medicare goes into effect in 1966. The very first conference on healthcare costs are under control, because I documented this, is June 1967, 1 year after it. And said, oh my God, the costs are out of control. And the only difference between then and now is they don't invite the employers yet. But one year, right?
But so, Michael, it was like a 20% increase in 1 year. So you do something. If you had this explosion on your hands.
It's free money for the doctors. It's free money for the hospitals. The Medicare law says doctors should police themselves, just like they all say now, just like you'll hear some of the Republican congressmen, right? So it turns out that doctors didn't want to police themselves. So it takes until 1974, not that long, before they start PSROs and peer review organizations and all that. They try health maintenance organizations, right? We're going to have maintenance and health in 1973, and those don't work, right? And then we get managed care in the 1980s, and managed care, who's doing managed care? Corporate America, because costs are out of control, right? And then when the backlash comes, does corporate America stand up and say, wait a second, this is overblown, this is it? No, corporate America goes and hides. And therefore the insurance companies go, screw this, why should we be the bad guys? And we go back to where we are. And then we have sort of trying to have pay for performance, which you can't use because it's plain English and it makes doctors feel bad. And so we call it pay for value and all the other little kinds of things. And so, you know, prior auth is a cat and mouse game because we won't do capitation and we won't do some of the full risk. We won't do some of the other things. And so we play games. And the purpose of the healthcare system is to have all your employees and all the voters feel that they're getting something for free without having too much of a backlash from them or from the doctors and the providers. And so that's what we get. One last thing. Did anybody else, that's just maybe me because you guys are pretty well plugged in, but I could not have named the CEO of United Healthcare if you'd asked me.
No, me neither. And I follow the company like religiously. I
Me
did
too.
not know his name.
Yeah,
Yeah.
I didn't know his name either. I know Woody's name because he's the boss.
So
Like I said, he's the fifth guy in the chain. But they have always, just to be clear, they've always been kind of under the radar.
They have.
He wasn't running the company. Stephen Hemsley was running the company from his lakeside estate on Minnetonka,
For sure.
using John Rex, his CFO, to make sure that everybody made their numbers. That's Brian. He seemed like a really nice guy. I've never heard anybody say anything bad about him.
Yeah, and obviously he was the guy there. I mean, I'm surprised that, you know, if you really wanted to have a go at United, I'm sure Helmsley is, you know, living in a very hard to get to and never leaves his house anymore. But he is being confronted. I mean, there is video out there of Helmsley being confronted by protesters at a speech.
It's Hemsley.
Sorry,
There's
Helmsley.
no L.
Hemsley.
Hemsley.
You know, and I remember, Michael, I was at a conference where you were actually interviewing Bill McGuire on the day when his stock option scandal, you know, came out.
Yes, I did.
What was that, 20 plus years ago. So, you know, this not you that they've been making money out of American healthcare, right? And not you.
McGuire
I
wasn't.
was supposed to be interviewing him with, you know, the feedback on the little iPad there or the predecessor, but we couldn't ask him about the $1 billion in stock, whatever that was in the Wall Street Journal the day before. So you're supposed to sort of go up there and ask him questions, except the elephant in the room, because after all, he did show up.
Yeah, Richard Burke was the founder of United Health Group.
I remember him.
McGuire was the person that was brought in the 1980s to turn it around after it crashed.
Right.
So he
McGuire was a doc. McGuire was a doc at an MBA, was he not, Jeff?
with Peak Healthcare in Colorado Springs.
Because I remember interviewing McGuire, and there's some docs who have an MBA, where, you know, they're doctors who got an MBA, and with McGuire, this was an MBA who happened to be a physician.
Mm-hmm.
All right. Well, let's go back to the sort of the bigger question here, right? Which is this going to make is what we're seeing? It's obviously tapped a massive nerve in a way, you know, of dissatisfaction. We can go back and forth in the role of, you know, why do we have insurers, whether or not they perform this role well, you know. That sort of managed care utilization review part is designed to manage costs overall. And, you know, the alternative, as Michael pointed out, is you don't have any of this stuff and you let costs go up 20% a year. Now, we haven't, as Jeff pointed out many times. Costs have stayed within the realm of inflation and within the realm of sort of 17 to 18% since the ACA, basically. So maybe Obama was right. Maybe we did save $2,000 per person in real terms. I don't know. But, you know, we're not at, you know, if I remember rightly, when I was in Institute for the Future, I saw a projection, don't think it was one I made, but a projection made by by CMS or their actuaries that by 2030 would be at 28% or 30% of GDP I can't remember what the projection was, but yeah, playing it out 30 years, it was certainly going up very fast in the 90s, and it didn't happen. So you could argue that the insurance companies have done their job. I don't know. You could argue that. On the other hand, Jeff, you talked a lot about the fact that this sort of game of thinking that this adversarial relationship between payers and insurers and doctors and hospitals is a misreading of what Kenneth Arrow said years ago.
Well, no, there were two threads in Arrow.
Yeah.
Thread number one was don't trust the doctor, and that gave us managed care. Thread number two was don't trust the patient, and that gave us high deductible health plans. And we did both of them. So we made health insurance basically into bankruptcy insurance. And we created this elaborate bureaucracy that diverts half of clinician time into typing to try and solve the doctor problem, and we made healthcare so user unfriendly that people are afraid to use it. So, I mean, I'm kind of like, I think there were a whole bunch of things that resulted in the flat percentage of GDP devoted to health. But if you'd gone back to the 1970s and told somebody we were going to have 12 years worth of flat GDP devoted to healthcare, they would have gone, yeehaw, or something like that, because it was beyond belief that health costs could actually level as a percent of GDP. There's been no celebration of it at all. We've continued blaming, we've continued pointing fingers, we've continued generating mistrust and now anger, if not actual hatred. And I mean, it's a tragedy because the core of this business is a bunch of frightened people having something horrible happening to them that they'd like to trust someone to help them with. That's the core of this business, this $5 trillion business. And the idea that, that even a fraction of our society think shooting a guy in the back is karma really tells me how far off the rails we've gone.
Robin.
So, I mean, the way I look at it, though, is these are for-profit companies that are behaving the correct way for a for-profit company in a democracy, right? In a capitalistic society. Nobody went and said, okay, United Healthcare, Humana, you guys are the guardians of everyone's lives. They are behaving the way that you would typically behave as a corporation, right?
Well, yeah. But what's the appropriate response if we don't like what the corporation is doing? We don't buy the product.
Exactly.
We don't buy the product. We don't enroll in their Medicare Advantage plan. We don't renew their Medicaid managed care contracts. We don't renew them if we don't like what somebody is doing, we send them a message, and the message isn't bullets.
Oh,
Well,
yeah, absolutely.
Jeff, what the question on that, of course, is that what they've, and I agree with Robin, although I've seen in the spirit of the season, I believe Salvation Army ought to convert to a for-profit. And if they can't show that they're saving more souls in every quarter, we need to change management. That's just my
and to be fair, there are plenty of non-profits that act like for-profits.
There are indeed. There are many nonprofits that put the profit into nonprofit. United exceeds them all. But look, here you have a nonprofit called AARP, which takes money from United. That despite all the complaints, the fact for years they've ranked last in doctor satisfaction, everything else, but they pay AARP, and so you trust them that it distorts the market, and you enroll in there, and they have great ads and people like that. So as we know, market mechanisms don't work all that well in healthcare. If I may get on another hobby horse here for a moment. Everybody loves price transparency, but our quality transparency is terrible. And I wrote about the rating of Medicare Advantage plans is not by Medicare Advantage plan, which is what common sense would tell you, but by Medicare Advantage plan contract, which is nuts. And so your Humana plan that's 5-star can be in 27 different states. And as you guys know, they merge people and everything. If you don't even tell people about the quality of their local hospital with data that's not 3 years old, or their health plan that star rating is not your health plan that you think it is, it's a contract somewhere. It's just bizarre. And the ACOs, you can't figure out the quality rating. I wrote that my ACO from a nonprofit health system that's local that says they're partnering with this population health management company. Turns out the ACO is managed by a private equity funded spinoff of a medical group in California. Which I only found because I used to be an investigative reporter. And the bureaucracy which doesn't enforce it. So Medicare is setting up the ACO legislation, and then the rules, and the ACA said there needs to be a Medicare beneficiary on the board. Okay. So who's the Medicare beneficiary of the board? First of all, they don't tell you who it is. Second of all, the board meetings are in public. Third of all, sometimes it's like someone is on the hospital board, the local banker. But my Medicare beneficiary for my ACO, which I tracked down,
The lawyer.
no, better. He's a guy who sold his company to private equity 2 years ago for $2 billion and now is a private equity advisor to another company. And the other guy who's representing patients is the retired mayor of the company, of the town where the company is based. I feel protected as a consumer.
Oh,
And here's the other, everybody talks about Medicare Advantage. None of the journalists looks at the ACOs. So the ACOs, in response to the managed care backlash, this goes, Robin, to you talking about market incentives, which are always inspiring. The ACOs, in response to the market backlash, said ACOs have to be owned by providers, 51%, doctors or hospitals. And they are. But then you take the 49% and you give it to a for-profit health plan or a private equity-run company to operate. You give them the operating license, you give them 49% interest. Okay, so much for you know, but to go back, actually, I think all this goes back, unfortunately, to what Jeff talked about, the anger in general. If you don't have a social contract, right? Where the president, a president of the United States and a presidential candidate like Trump can talk about violence against people and others can, and nobody says that's wrong. If you don't have a social contract that says, you know what, we don't talk about threatening violence and enemies within. You know what? We have a social contract where we want to cover everybody with health insurance. We can disagree about how to do it, but the choices are not either be Canada and England or high deductible, no third party payer. Turns out the rest of the world has something in the middle, like Germany, like Switzerland, like Israel, like all these other places. If you don't have a social contract, then there's no limit on what people.
Well, this was the problem with Uwe Reinhardt, who I adored. He was a close personal friend, and his perpetual outrage that we weren't a social democracy. Well, we're not a social democracy.
We're not, but we can do something.
We're an interest group democracy with an incredibly dynamic economy, a big dynamic part of which is this $5 trillion activity that we're all experts in.
But you could still.
We're not a social democracy.
Right. And then as Brian found out when he did the Center for Practical Healthcare Reform and found that every interest group in the world would have a meeting with him.
Right. You bet.
Yeah.
Well, how do you fix it? What do you, Mike, what do you do about it? How do you get to a better place from where we are?
Sometimes, Jeff, and it's a great question. Well, first of all, if you said public financing of elections, the people who get the money now would have to approve it. If you talk about some of the limits on campaign financing, the Supreme Court said PACs can set to do whatever they want, right?
Good place to start.
Just like after John Kennedy was assassinated, we banned assault weapons. Now, for some reason, the law has changed, right? And so if you have people who believe there isn't a social contract in the Supreme Court, you're in trouble. But the only good sign is if you look at surprise billing, okay? Despite the interest groups put it up.
United Healthcare bought, no surprises. They bought it. They bought the research that justified it from Zach Cooper.
That's true.
Is that a solution?
No, I mean, people, there is no solution if transparency doesn't do anything. I mean, I'll be honest with you. When I see articles about medical debt or people who are uninsured, right? I say to myself exactly what you do, Jeff, about solution. I say, why are we writing the same article that your grandfather could have written? What we should say to the people is, okay, you're uninsured and blah, blah, blah. What should the country do about it? Well, I don't want socialism. Well, I don't want this. Well, I don't want, right? I mean, but we do this bleeding heart stuff about all these victims, okay? And these are the same people who go and vote for the people who give them high deductible health plans and everything else. I mean, what is the solution if the people who are hurt, the so-called 40% of Americans have medical debt, was that series that said that. And I wrote to Drew Altman on this. I was like, Okay, but if they're not going to do anything about it, make it a crisis, what does that tell you, right? I
Let,
mean,
let, let, let me drop. We just had an election. You may remember this. It was
yes.
a few months back. I mean, did we a month
Weeks
back,
ago.
right? Who heard what was said, with the exception of we're going to control pricing from those evil drug companies on
Right.
insulin and eventually some other drugs? What was actually said about healthcare in the whole process?
It
Almost
was a
nothing.
second tier
Nothing.
issue at
Yeah.
best. Second
Right.
tier.
Now, the issue that Michael raised, and Robert, I know you're about to come on, so I'm going to go to you next. But the issue that Michael, and you may respond to this or not, the issue that you've all raised about what's the level of anger, the level of outrage in society, and the fact that we can now, have at least one presidential candidate talking about violence and, the enemy within, all this kind of stuff, and the very, very language and stirring up people, and it's been going on for years. That issue to me, is bad. That was the election. So, so I don't see much way out of where we are on both the sort of the outrage side and also figuring out how this flows through to a better healthcare system. Robin, you've been trying to get in for a while, so sorry.
Oh, I mean, I always have some kind of an opinion. So, I mean, what I would love to see is much more transparency. If we can start to understand exactly how much something costs before we go there, how much the doctor's being paid, right? Just like cost plus drugs, they break it out for you and they tell you exactly where every single dollar is doing. I would love to see that because then patients will have much more power to say, no, I'm not spending my money here. I'm going to go to the hospital down the street.
But if all
Yeah.
they've got is the price, and we don't know anything about the quality, that continues to be a recipe for disaster.
I think it's worse than that, right? I think we don't understand the flows, right? You have two areas where I see this. Where one is like the whole thing about the PBMs, where nobody actually understands what the hell's going on in the middle of that flow, and they are saying, and there are two different bodies of opinion. Some say they're putting the price up, others say they're getting kickbacks, others say that the rest of them say they're putting the price down. There's just as Michael Lewis says about Wall Street, the more complex you make it, the more likely you are to being stiffed. That's one thing. The other one, which just drives me nuts, is this issue of Medicare Advantage costs. Whereas if you look at what MedPACs say, they say it costs 7 to 10% more, to put people in Medicare Advantage. If you look at the Medicare Trustees report, they have data which shows it costs somewhere between 10 and 15% less. And I'm going, somebody should be able to look at this rationally and price out what the actual truth is. And no one seems to have done it. And you hear it back and forth. Anyway, Jeff.
I mean, I'm a 10-year plus Medicare Advantage user, and shortly after I enrolled, my health crashed. I had cancer, and then I have to have my two hips replaced. And I was like, cancer, I was going to do myself, but the hips, I was like, okay. I called my Medicare Advantage carrier, and I'm not going to say who it was, and I talked to their network guy, girl, whoever it was, and said, I'd like to go to your highest performing hip replacement specialist in this region. Who is it?
Wow.
They had no idea. I talked to they had no idea. Maybe they had the data, but they hadn't organized it in a way that I could use it. That
It's
really
so ballsy, Jeff.
that opened my eyes. That sort of opened my eyes. And then, so I talked to a surgeon and I said, if you're going to have your hip replaced, what are the two things that you'd want to know about your surgeon? And he said, the redo rate and the readmission rate post-op. Those were the two indicators that he said, if they've got if those are bad indicators, you don't go to them. And none of the surgeons that I interviewed, and I interviewed 5 of them, could tell me those things. So that was a decade ago.
Could or would.
I mean, I gave it the old college try because it was my hips, and I wanted my hips to work. And no one could tell me. I really tried to be an intelligent consumer, and I didn't even have anything at risk economically, and no one would help me.
So we
Not
haven't
my
had
carrier,
somebody on
not the doctors.
We have somebody on the podcast who's written a book called The Patient as CEO. So Robin,
wait, I have a question.
Tell us
Jeff,
tell us where we are. You think we are in exactly
Jeff,
Jeff's question. Hang
Jeff,
on, Michael. We'll let Robin talk, and then we'll go back to you.
Jeff, could the doctor?
Michael, let Robin talk.
Oh, I'm sorry. Go ahead.
Senator, she's speaking.
So we're not very far. Most people that I come into contact with don't even know that they can take control of their own healthcare. Right. And so, like, I'm getting some bills right now from a company that comes in and does my Remicade for me. And I've been with them for 60 Remicade visits over a number of years, and they keep overcharging me for something. And I'm like, I'm standing up to them, but I know most patients cannot stand up to them because they don't even know if they have another option. Right. I can't go off Remicade. I need this to live. I know I can get it with Sutter Health or something like that in my home that way. And so patients do not know that they have control. They do not know where the money is coming from, right? And then they don't understand healthcare. And so they're terrified, and they go into a doctor and they expect the doctor still to be the one who monitors their health year round, not for that 7-minute visit.
Yeah, I have. I'm coming to you in a second, Michael. I have, and I get the frustration. I've just had in the last year 3 experiences with insurance companies, not in healthcare, about house insurance and car warranty. And my conclusion is that when you buy something, you don't really know what you're doing, but the tricks that are run on you by insurance companies to, and these are not MLR guaranteed things. This is like I had a car issue. Just had one last week where my fuse blew. It was a $500 job. I'm supposed to be covered by this warranty, but apparently because the fuse blew because there was something stuck. My kids had left a bottle or something in the car track which caused the fuse to blow. It's not covered because it's not normal operation. I had an issue with a roof damage when a tree fell on my house. State Farm came back. They said, they gave me an amount of money which was equivalent to about half the rate that the actual contractor charged to fix stuff. So basically, it's kind of like the high deductible care and surprise billing. You're pretty much on your own, and there's not much interest from these folks to help you. Translate that into the healthcare scene, and I think I understand why there's so much frustration. Brian, then Michael. Sorry, Brian, were you trying to get him?
No.
If you weren't, Michael, I interrupted you earlier, so now I can uninterrupt
real quick, first of all, I'm incredibly impressed, Jeff, that you went to them and said, "Who's your highest performer?" I'd never think of asking my health insurance company that. I'm also surprised that, given who you are, that they didn't get back to you and try to figure it out.
Well, they may not know. Mind you, I have an interview in the CAM with a company called Lantern, which is one of these employer direct contractor organizations, and they think they know who the highest performers are. So I think, and I know that folks that included health and others have been, working on this data. So I don't know if this is true or not and whether you can get to it, but there are a number of people talking about doing it.
So I want to give you some good news in that. So I think AI is going to blow this whole thing up, right? So a physician walks into his ENT at Stanford, and the guy recommends that he get an endoscopy. But before he agrees to do it, he gets a printout of what that particular institution's outcomes are for men of his age group over the last 5 years, both in terms of complication rates and when they find cancer or whatever. Now, that only happened because the guy who was the patient was the chief digital health officer at Stanford, and Stanford has the Green Button Project. But here's the thing. That project is now expanded into a for-profit company called Atropos, which is doing that with folks all over the country. And so the doctors can find it out, right? And then Epic is doing its Cosmos project, which is kind of similar. And my feeling is, and the doctors don't see this because they're stuck in this paradigm, all this is for-profit companies selling it to doctors. I get it. There is no way on God's earth in our litigious society with the informed consent laws and everybody who knows a doctor is related to a doctor or whatever, where that kind of information remains for doctors only. Not going to happen. And so we are going to end up, although the doctors don't see it yet, with performance information that is personalized and accessible. It ain't there yet, but it's coming. And when I talked to John Halamka of the Mayo Clinic platform, and I've asked him point blank whether or not, if Atropos is on the platform, whether patients would be able to buy access, or certainly employers buy it for their patients, right? He said yes. Now, do I think that once this is used by patients to choose their doctor and health system, that the health systems are going to try to shut down the data access? That they're going to try to get some legislation through that special interest that says, no, no, this is too dangerous for you to know? Sure, they will. I'm not sure they're going to succeed thanks to America's lawyers.
So I was seeing Hallie Tecker from Rock Health had a piece on LinkedIn today about a survey they did of people 10 years ago, asking what the future of healthcare was going to be 10 years
Yeah.
in the future. And there was all these great pronouncements about how data and buying and technology was going to fix everything. And obviously, not much has changed in that. So I went back and reread Demanding Medical Excellence, written by a certain Michael Millenson
Yeah.
in 1998. I mean, I
1997.
wonder, I wonder at what point you said we'd have solved the problem you just mentioned, right? And now we're waiting for AI to solve that problem by
Well-
going and looking at every
Well,
EMR and the rest of it.
I have a track record of being 100% over optimistic, but but having said that, I am now looking at something that is actually being done as opposed to predicting, I don't know, hospital report cards. So again, knowing America's lawyers, if you have information that can tell me whether or not my operation is going to be a success, and you say, no, don't worry, that's for doctors only. Good luck with that.
Well, what I want my colleagues to tell me, and there's a lot of wisdom on this call, is what we do about all that anger. Because it seems to me there are technical problems, there are data problems, there are transparency problems, there's all these problems that are at least at a technical level soluble. What do we do about all this anger?
So I have a opinion here, which I don't know it's fixable, right? So I think there's two things going on. One is that we have we're American, we're not a social democracy and blah blah, and I get that. We're not Finland. We're not going to be all in this together and make sure that the highest paid person who makes 3 times what the lowest paid person makes or whatever the numbers are. But we don't have to be at the point where the average, the concern about the average person. I mean, the guy who drove my Uber in Phoenix the morning after the election, who was a black guy who told me he didn't vote for Kamala Harris because she'd put other black men in jail. And by the way, the rent on a studio apartment in his grotty part of town went from $700 to $2,000 in over time. And that he didn't think he was making it and had no chance, basically. And a pox on both your houses. He didn't vote for Trump, but enough people like him did to make the difference, right? So that's part of the problem, right? And you see that go on. You may remember back in around the Occupy Wall Street time, 2010, something like that. There was a very good sort of video done about what Americans thought the state of inequality was and what it actually was and what they thought it ought to be. It was way out of whack then. That was before 15 years of massive stock market growth and Bitcoin billionaires and Elon Musk going from being worth 1 billion to being worth 300 billion and all that stuff. So we know inequality is out of whack in a way. Someone said to me today online, well, that sounds Jacobinist. That's kind of where they were.
Matthew, do you really think it's about the money? Do you really think it's about money?
So one, I think it's about
or do you
inequality.
think, or is it possible that it's about people feeling that they aren't respected, that they don't matter? It seems to me, there is a Jacobin quality to that thesis. I'm sorry. I'm not sure it is about the money, and I say that as a capitalist. I'm not sure it's about the money.
But I think money is how we count respect in this country. And if you see everybody else making it, so the other thing I was going to flip is that it's clear that the social media, and now you can believe or not that it's driven by propaganda and the Russians have been paying off people and that, you can believe or not what you like. It's clear that social media has hardened people's attitudes and made them more aggressive. And I was an internet optimist when this all started. I was one of the very first guys on the public web and all the rest of this in communities. And I thought good information would drive out bad information. It was completely wrong. Could not have been wronger, right? And it's clear that this has driven people into their echo chambers and their segments. And we now have no agreement about what a fact is, right? Absolutely not. And to me, you put those two things together, and you add it to a country where there are how many 100 million guns that you're in a recipe.
400 million.
I mean,
Yeah.
too many 100 million,
Counting.
right?
Yeah.
You're in
400.
a recipe for problems. So I don't see an easy way this gets solved unless somewhere out of all of this we develop a sort of rational middle social calming movement. We're going to have extremes. We're going to have extremists. We're going to have violence. That's going to continue to happen. But I think maybe I don't know where that sensible center comes from because they just lost an election and everyone says they're stupid.
I mean, I think that
Brian, then Roy, let me go.
to Jeff's point, I think that the rage is a function of people's of people thinking that nobody has their interests at heart. Nobody is there to protect them, and I think that's where we started the conversation today.
Mm-hmm.
But guys, if you look at so I did political science at Cambridge, so I'm a good communist from way back when. If you look at revolutions, the history of revolutions, almost all of them come from big dislocation, including economic dislocation and unemployment. Fascism in the 30s came out of massive unemployment in early Germany. Same thing. A lot of people in the Soviet Union sitting around with nothing to do post World War One. You have wars. You can argue that we had the big dislocation, the Great Recession in 2008 to 10, but I don't see. I mean, the economy in the U.S. today, you may be struggling, but you can get a job.
Matthew,
4% unemployment.
Crane Brinton said something else in Anatomy of a Revolution. It wasn't absolute deprivation. It wasn't a shock of stuff being taken away. It was the dashing of hopes. It was the confounding of rising expectations that caused revolutions, not deprivation and not a shock, an economic shock. That one, it's like one guy, but it was a very convincing argument.
We can argue that, but how did our when were our hopes good and when did they get dashed?
Yeah, but you have the presidential candidate very smartly saying things are terrible, things are right. So Trump's thing is don't believe, whatever that. Things are terrible, and so that's how you get the populist kind of things are justified because of them. I mean, he has very clearly stayed on message, despite how he wanders within that message. It's us versus them, and the transgender ad, which some of the Democrats poo-pooed, was a very graphic us versus them, and even though it showed him, with his arm around an elderly black woman before showing a very all-American, white couple and their two kids before them, and them with a big arrow pointing to a girl with a mustache. It may have been crude.
It was brilliant.
It tapped an underlying feeling. And frankly, when you won't use the word woman to refer to the people who give birth, it encourages people to think that you're nuts. Even if all your policies are good, when you refer to birthing people who now are on the people who give birth. I mean,
this is concerning, Michael, because we have a peer group that believes that if you have the right policies, everything's going to work out fine, and our job as stewards of the public trust is to figure out where all that money ought to go and who's fair and who isn't and who's deserving and who isn't. That is what Trump, I think, convincingly ran against.
Absolutely.
They hate it, and that doesn't mean that policy doesn't matter. It really does. Making the right choices really does matter. But it's a terrible political.
Let me remind you, we are at the Trump landslide, 49.8% of the vote. A percent and a half in between the two parties.
I got the numbers on that, guys. He won Wisconsin by 49.6%, Michigan by 49.7%, Nevada by 50.6%, North Carolina by 50.9%, the country as a whole by 49.8%, and it was a landslide. It was a landslide in his head.
But he also lost. They managed somehow these votes appeared for him, but not for the senators in those states, all the governors, all of which went the other way. So I mean, but if you go back not very long, right? I mean, Obama won with 53%. But go back to the 80s, right? Reagan won with 58%.
62,
Johnson
yeah.
won with 64, with 64%, 64.
Johnson was 60, something like that.
Nixon at 72 won with something substantial. So what I'm saying is that you had a point where there were real mandates. There was, I mean, whether you like it or not, there were real mandates around things that Johnson was talking about and Nixon was talking about, all the rest of it. And now we're in this position where, the margins are so fine. I've been in the last 3-4 elections that,
But he's got the Senate. He's got.
I mean, the structure of U.S. politics is that you get.
And he basically lost the House. So it's sort of like the testosterone surge that's underway now is going to, excuse me, gentlemen and ladies, peter out.
Good.
We'll see. Well, okay, we're close to an hour here. I want to quickly go around. I mean, we didn't get to talk much about what Michael wanted to introduce, which was the 2 hours human. We talked a little bit about quality, but we haven't fixed 2 hours human. We haven't fixed the poor discourse of the social media or the social sphere or whatever you want to call it, and we haven't fixed it. Clearly, we haven't fixed violence in American public and now corporate life in a way. So can we go around? Is there anything as we go around? I'm going to go around and ask somebody to say something optimistic or pessimistic about where we think we are. So I'll start with you, Brian.
We've got to find a way to restore a sense that there's a social contract, and that there are forces out there that will protect us. And if we don't find that, we can't succeed any further as the country we were.
Jeff.
We've got to figure out how to take care of each other.
Mm-hmm.
We've got to figure out how to take care of each other.
Yeah.
R's, D's, blue, red. We've got to take care of each other. And I don't know how far we've got to descend into this spiral of blame before we realize that we're a whole lot stronger if we work together.
Robin?
I just don't see that particularly kind of happening, because the social media that does really well is the negative stuff that gets people really angry. And so that right there is a different issue. But what I am super excited about over the next 2 to 3 years is generative AI and the AI-based medical scribes, because we want to give our providers back some time so they can deal with this kind of thing and actually provide care to patients.
I mean, I agree that generative AI has got enormous possibilities, and it could go, it's one of those things where it could really help a lot of people, and it could really it could put a lot of people out of work and make a few people rich, and we have to manage that piece a lot. Michael, I'll let you have the last word.
So 2 small pieces of optimism. The first is I thought the group today was so thoughtful that actually, it's really good for healthcare that everybody here is still in the fight. So I'll have a small bit of optimism about the individuals. Second of all, let me give a piece of bizarre optimism, God help me, about the Trump administration. So this is the 25th anniversary of the Errors Human Report, which said that 44 to 98,000 people die each year from preventable medical errors. We're supposed to cut that in half in 5 years. After 10 years, it had not moved at all. And now after 25 years, perhaps it's moved a little bit from 1999. But the latest estimate from the Leapfrog Group is upwards of 160,000 preventable deaths in hospitals. However, interestingly, the Trump nominee for FDA, Marty Makary, has written about medical error, calling it the 3rd largest cause of death in an epidemic. And even though he would not be head of CMS, he would be the administration. Mehmet Oz, whose TV credentials are impeccable, in fact, has at least worked at a large medical center, so he's probably seen medical error. And lastly, RFK Jr., the putative secretary of HHS, while he's busy not getting a vaccine, it turns out that that diagnosis of having a worm in his brain came after a diagnostic error that was about to have brain surgery. So he has personally experienced the diagnostic error. So it could be that in between telling all of Americans not to believe anything about public health, they will in fact do something about medical error as more and more people go to hospitals because of what they say about don't trust public health. So that is my cockeyed optimism.
Jeez.
You have been watching, and I want to thank my guest today. You have been watching and listening to Michael Millenson, the optimist from Chicago. Brian Klepper, the appealing to the social contract, all the way from the very red state of South Carolina. Robin Farmanfarmaian, from who thinks generative AI is going to fix it all for us if we're damn lucky, from the Silicon Valley hub of Palo Alto, and Jeff Goldsmith, who is hoping we're going to find our way out of this, and meanwhile calling his managed care advantage, Medicare Advantage plan, looking for information they don't even know exists from the streets of Virginia. I'm Matthew Holt saying thanks for listening, thanks for watching. There will be no THCB gang next week because I'm going to Japan to eat some sushi and some drinks, eat some ramen and drink a bit of whiskey, and take part in the Health Tech Summit Tokyo conference, which I do every year. I'll be back. There will be two the week after, one a regular gang and one a bunch of patients, a bunch of very leading edge patients talking about how they're using generative AI. And with that, I want to say thanks to everyone for watching and listening, and we'll see you soon.